Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, and I'm joined this evening with Lizzie, an administrative fellow at UC San Diego. Lizzie, please introduce yourself to everyone.
Hi, everyone. Thank you so much for joining. My name is Lizzie Case, and I'm a current administrative fellow at UC San Diego Health. Thanks for having me.
We're so happy to have you this evening. So we'll go back and start at the very beginning. You could say you got a bachelor's in law and public policy. Can you explain what your interest in that was, and then what your interest in getting the MHA was? Excuse me.
Yeah, absolutely. Great question. First, for my bachelor's in law and public policy, I know I always wanted to do something involved with the community and helping others. And so I thought that through law and public policy, that would be a really great avenue to have a better understanding of, not only government at the local level or state level, but also national level as well. Ironically enough, I wanted to go to law school. That was my initial intent when choosing that degree. But as I started to consider, master's programs and what, life would look like post college, the master's in healthcare administration really reached out to me. And I feel like I aligned with more of what I was looking for in my career post college.
Makes a lot of sense. Law school is tough, and especially if you want to be in health law. I know that it's good to actually have a kind of a practical experience as a healthcare executive. What drew you to being in healthcare, or were you always interested in health law, or is this kind of a completely new area for you?
Yeah, no, I think healthcare was always part of my life. My mother is a registered nurse and actually just pursued her own master's in healthcare administration. And so she worked in the ICU and the emergency department for several years of her career. And so I always remember growing up listening to stories about her coming home from work and kind of the way that, only impacted her, but our family as well, being part of the community, as well as she worked at a surgery center as well. So kind of getting to see both the inpatient, outpatient side from her perspective. And I think like a lot of families, you always have a family member or something that really strikes you, that really moves you to be part of healthcare. My grandmother was diagnosed with Alzheimer's disease and sadly passed. And so kind of seeing her treatment as well throughout the healthcare system, kind of combined with my mother's experience and hers, really drew me to this career. And I'm glad that I'm here.
It's great that you were able to find a career that meshes your interests, and that also you have that inspiration from your personal experiences. I noticed one thing that really sticks out about your resume is you've just had so many experiences and really incredible ones with amazing organizations,
Yeah.
going all the way back to during undergrad. Can I ask, what were any that stick out in particular for you?
Yeah, absolutely. I think each experience is in such a different realm. So, for instance, in undergrad, volunteering Meals on Wheels, I think was a great way to connect with the community and really connect to my personal mission in healthcare, driven to really provide for the community at that level, as well as holistically within health. But, I think that kind of started my peak interest in regards to also my personal journey within healthcare with my family. I think also in my graduate program, really formulated my and solidified my want to be part of this industry. First, being a researcher at Health Fairview really gave me a unique perspective. I was a student researcher in the pediatric echo lab at Health Fairview. And so I think it was really interesting to see children's medicine. That's something I hadn't done before, but kind of the unique attributes that were a part of that particular area of healthcare. I think also working for Phillips Neighborhood Clinic in Minneapolis, which is a student run clinic or organization within Minneapolis. And we provide free healthcare to all those underserved within the community, regardless of insurance status. And so it's really amazing to see that we're be able to provide care to those who really need it most within the community. Again, really aligning to my why healthcare. But I think things that really formulated me from an administrative perspective was definitely my experience at Mayo Clinic. So working there, I think, in Rochester, Minnesota, one of the best health systems, in the country. Such a phenomenal experience getting the unique opportunity to work with their operational leadership within the ED and the just hospital leadership as well. And I think also my experience at UC Irvine Medical Center, I think really pivoted my love for the UC system and really helped formulate myself as a young careerist. It really helped me connect to my fellowship that I'm in today.
It's just an amazing breadth of experiences. I did Meals on Wheels myself. My granddad, he used Meals on Wheels. And so, I was originally pre med. So I was looking for kind of like
Wow.
experiences that I could connect with.
Yeah.
And I was like, oh, my granddad did this. So I need to, provide what my granddad benefited from. And so I love
Mm.
that experience. And you did that for a long time as well, right? It looked like on the LinkedIn, like 6 years or so you were doing that.
Yeah, no, absolutely. I think it's such a powerful way to not only give to the community, but also connect to the community as well. And I love that personal story and connection that you have with that such a phenomenal organization, and just really, again, I think inspired my want to help the community, connect with the community. I wouldn't have had any other way. Just absolutely loved that experience, and I'm also doing it with my family members as well. Was something special that we did, and still, wish I could go back and do, and maybe find something here in California like similar to such an organization.
That's really nice. That's a great family experience. So I want to ask, for me, I've struggled with this, and some other students mentioned this to me as well. If they really struggle with this, since you've had so many great opportunities, how do you get these? Is there anything at that stage that you did? Was it networking? Was it, did you formulate your resume in a certain way? How did you get so many internships and opportunities?
Yeah. First, I think University of Minnesota really helped pivot some of those opportunities and connections. And I think when you're thinking about, what graduate program to pursue, if you're wanting to pursue a master's of healthcare administration, for instance, kind of thinking about how that can connect you to not only the experiences that you want to gain, but kind of how those experiences will help pivot, depending on where you'd like to be post graduate school. So I'd say I think my professors and those within the School of Public Health at the University of Minnesota were really helpful, kind of connecting and creating those pathways, especially for my opportunities at Health Fairview as a researcher, or at Phillips Neighborhood Clinic, operating as a clerk, a telehealth scheduler, and an operations associate for our board. I think, having the opportunity to be within the School of Public Health and also coordinate with other individuals that are in the healthcare field in a way, like the physicians or the nurses or social workers, and also having the opportunity to connect with them also provides opportunities that you never thought possible that are kind of outside that realm of healthcare administration, which I think is very valuable when it comes to being in this field. I would say also networking. I really rely on, events like ACHE Congress is something I'm going to soon coming up, but other just local events through your ACHE chapter or other, similar organizations that can connect you to leaders or individuals and organizations that you might have interest in. Some of the connections I've made have been through those and have provided the opportunity of where I am today. So I think leveraging your network is so key to finding those opportunities, and, having individuals be like, oh, I know how you have this experience, or I knew you were looking for something like that, and kind of helping bridge that gap to finding where you want to be.
Very good advice. Leveraging your faculty, your network, and then also being intentional, like you said, on what you want to do and how it's going to benefit you afterwards. That's wonderful. And so, with all this experience, one thing that I've been asking our fellows who have lots of experience before going into the fellowship, or more than average, I guess, is why did you choose to pursue a fellowship?
Yeah, that's a great question. Even though I have these amazing experiences, I think it doesn't hurt to get a little bit more experience. So I felt like I needed a little bit more experience to not only experience, but also kind of tailor, where did I want to be in healthcare? I wasn't really sure what aspect I wanted to pursue. I was interested in operations or strategy or population health, but, what opportunities was I really interested in? And I really feel like I needed a deep dive. And I think the fellowship, regardless if it's a year or 2 years, really provides the opportunity, or even consider other opportunities that I had never thought about before. I think it really is a unique experience to survey the entire health system, to not only understand how each piece individually, but how each piece comes together as a whole for the system. And again, really finding what aligns best as you kind of navigate through the system as a fellow, and then what you want to look like, post fellowship in your career. I don't think there's really another opportunity like a fellowship graduating. I really want to make sure that, you have experience early in your career to really set yourself straight with, where you want to pivot. I think the ability to meet leaders all across the system and kind of build that mentorship and relationship for years to come post fellowship is also something that it provides. And, and versus maybe being more siloed in a career or postgraduate school. So again, that networking piece and kind of alignment, I think, is key. And that's what the fellowship provides. And that was something that I was looking for. Can't say it's for everyone, but I think it was the right decision for me and what I needed at the time.
Absolutely. Yeah, no, that makes a lot of sense. So I guess a few questions on that too. How many fellowships did you apply to? And then why did you end up going with UC and San Diego?
Yeah, absolutely. Great question. I applied to 12 programs, which I think is a lot. I think a lot of people might not apply to as many as I did. Some people might apply to like to 1 to 4 or 5 to 6, but I really wanted to see kind of all the potential opportunities that really spoke to me and kind of evaluate my options. I applied to programs mostly on the West Coast because when you're thinking about a fellowship, it's somewhere where you could be for 5 plus years. And so thinking not only for your career, but also where you're actually going to be physically living, I think is important to consider. But I applied to places in California, Oregon, Washington, and Chicago. And the application process is very different because it just kind of depends on the organization that you're applying to. And so everyone's experience, I think, is going to be a little different because, again, every organization has their own timeline and process. So regarding the application, you could be applying on NAVCAS while others have you apply on their own jobs website. And so you kind of have to coordinate and figure out where that is. Each application, I think, has different requirements as well. So, like for some instances, they might require one letter of recommendation versus maybe 1 to 3, one being academic and one being professional. They kind of have those different components. Some applications also have additional questions that require a short paragraph response. And so, again, those can kind of depend on the organization that you're applying to. I would say across the board, a cover letter and a statement of purpose are pretty typical and required. I would say the statement of purpose is the most important piece of your application. The resume and everything else I think is great, but really having your why healthcare and why you align and why you really want to be at this organization is something that I know after going through recruiting our next set of fellows is something that we really value in the application process. And then I think the timeline piece too is tricky. Some institutions start their application in August and September, some October, November, December. And so you're kind of playing this timeline game between, hearing back from different organizations at different times. And so, you might really want 2 organizations, but they might be at 2 different timelines. And so sometimes it makes it a little difficult to choose. But, as you move through the process and the interviews, I think you start to realize where you're meant to be.
Definitely. And why did you go with where you went with? How did you know?
Yeah, absolutely. Well, of course, I love the UC system. I knew that's kind of where I wanted to be after working at UC Irvine Medical Center last summer as an intern in the ambulatory department. I just loved the UC model. I loved academic medicine. And I knew that's like really where I wanted to be at the forefront of innovation and research while also, facilitating that patient care component. But when I interviewed at UCSD, they're one of the best hospitals in the country and the best in San Diego County, just world-renowned research in several different respects. But when I was interviewing with, the individuals, their leadership really stood out to me. The preceptors that oversee the program, Chad Vandenberg and Lisa Murphy, were just such phenomenal leaders. And I knew in the interviews that they would be able to provide, the type of mentorship and guidance that I would need. And, as a really careerist, as well as meeting the other fellows and leaders within the organization, having that longstanding fellowship program and retention of fellows really spoke to me that, this program will really provide the steps and leverage that I need, to be successful as a young careerist. And I think I knew from the final round interview that, these were the type of people that I wanted to surround myself with and that I could be inspired by. And so I knew by the end of the final round interview that, if I was given the opportunity that I would love to have a place here. And I'm glad it worked
Nice.
out.
I'm so glad it did. That's excellent. Wow. And so then what was the first few months like and what kind of, fellowship is it? Just some details on that.
Yeah, absolutely. Our fellowship is a 1 year project and rotational based fellowship. And so that was also something I was looking for. I was looking for a year program that also could provide that rotation and project based. So the first couple months, the first probably 5 months, I was rotating through the system. So I was seeing a new space every single week, which sounds pretty crazy, but it was a lot of fun. So kind of going through our different areas, strategy for 1 week, finance for 1 week, facilities for 1 week, and just different aspects of the organization. And I just, even though we're nursing, even though, I'm not a nurse, but it's so important to have that perspective and understanding of the different components and their leadership. And I'm just so grateful for the opportunity to, understand each piece individually. And then, again, how it puts together as a whole for the system is important as an administrator, especially when you're not having, a traditional clinical background, and also just understanding them, where they're coming from and what I think is important. So yes, project based, and then I was also doing projects in between as well through rotating through the system. And now, since probably December up till now in March, I've just been doing projects for on various initiatives throughout the system. And so I kind of like the balance of both, having to have been seeing the system, but also having the opportunity to kind of work in different aspects that align with my interests or I'm asked to work on, which is a great experience. And I think we've just acquired a hospital, and so that's been a really great opportunity to see as a fellow behind the scenes. And and we're going to create a new partnership as well. So a lot of great things going on at UC San Diego Health just as a fellow, and just the rotation and project based experience.
Yeah, that mesh of rotation and project base as well. I was talking to a fellow earlier today, and it's the same reason for his. Is it was, it's challenging to choose. I guess one or the other. Each has pros and cons. So having that mix is I think excellent. So,
Absolutely.
what are some of the areas that you are really looking forward to maybe working in long term, or that especially are of interest to you?
Yeah, absolutely. I think the two areas that I'm leaning in most would be either project management. So, project management, either working with our transformational health department or a physician group, and or I'm a project manager for our cancer center. I absolutely love the team there. I'm also considering looking at clinic operations manager positions as well. So, I think those are kind of the two areas I'm looking to at the moment.
Wow, that's very exciting. Can you tell us what draws you to those areas?
Yeah. Well, first, I think operations is just, the core, I feel, of the organization, like really functioning how we work in different capacities. And I think being a clinic manager, especially like going through the day to day with those on the front line, it's just a unique experience as an administrator and a needed experience. And kind of, how do I manage the day to day work, but also how do I incorporate projects that enhance, not only the work for our patients, for my team and my staff. I think is such a unique and opportunity in healthcare. And then for the project management side, I like that area of work as well because working with diverse stakeholders across the organization. So we're working with physicians, we're working with IS, we're working with our call center, our clinic managers, our directors, and kind of figuring out how we can delegate, some issues in regards to, service line specific or across the continuum of care. And so having that opportunity to work with, different individuals for the same goal, I think is what's great about project management within the health system.
Oh, definitely. That sounds like a both of those sound very exciting. So you've been successful. I assume you're probably looking to stay with the same organization.
Yes, absolutely.
And
That would be
because
the
you
best.
mentioned that a few times, so the fellowship retention is good. So I want to ask, do you have any tips for those earlier on who are aspiring to be in a position that you are and who want to do as good of a job as you've done?
Yeah, absolutely. I think if you're wanting to pursue an administrative fellowship, especially, I think networking early doesn't hurt. I think when I was thinking about a fellowship, I reached out to current fellows and past fellows of the organization as well that had stayed within the institution and kind of asking why, why do you like to work here? Why is this your place of work, what inspires you to be part of this team, and also reaching out to other leaders in the organization, I think gives you kind of a good picture before walking into the application process and really solidifying where you want to apply and being intentional, like you said, on where you want to be. Again, I think networking within your local community is also great. If you're a part of a graduate program, kind of leveraging the types of opportunities and partnerships that you can provide, while you're at school, I think is essential as well. And I think also just finding a really good mentor. A mentor has been so key for me, not only in this fellowship, but in my past roles as well. Having an individual who understands, where you are and where you've been and helps you where you want to grow and thrive as a young, you don't know everything, right? And so it's really nice to, have when I'm really going through something or I have a question or an application question or whatever that might be, depending on where you are, I think just having them as a North Star is so key in helping you, get to where you'd like to be.
Definitely a personal question here. Uh, how did you find your mentor?
Yeah. That's a great question. Some of them just kind of evolved naturally, right? I mean,
Mhm.
at UC Irvine Medical Center, Doug Nowinski was such a mentor to me in the summer and really helped kind of push me towards the fellowship, especially being a fellow. Other other mentors I've had throughout the way, my fellowship, for instance, have just been leaders that I've met across the rotations or who are past fellows, and I lean on them for advice all the time. Um, Other mentors have just kind of evolved naturally. I've found at events that I've gone to, like networking events, and it's just crazy. Now we're still connecting, years later. So I just think sometimes you can find mentors in all places, whether it's, already set or just naturally fluid and just kind of happens. I think that's the best kind of mentor to find though.
Excellent. Well, thank you so much for your advice. I think all of it's been very good and for coming on. I
Yeah.
think it's around 4 o'clock in California, right? So not too late in the evening.
Yes,
Um,
that's correct.
well, excellent. Enjoy the weather out there in the community, and hopefully we can connect again as you progress into your full time role.
Yes, absolutely. Thank you so much for having me. I appreciate it.